Would you believe me if this was not the first time a hospital has kept a brain dead pregnant woman alive? Back in 2017, a young woman by the name of Frankeline, I think that's how you pronounce her name, she was about 21 or 22. She was pregnant at the time and she started having headaches. Same situation like Adriana Smith. Her boyfriend brings her to the hospital while she's getting medical care. She suffers a stroke. Now, at this point, this is where these two stories start to differentiate. In the case of the young woman in Brazil, the doctors did decide that, since she's brain dead, they're going to take her off life support, even though she's pregnant. However, when they took her off life support, they realized that the heartbeats were still there for the twins. She was pregnant with twins. So they made a collective decision to try to keep her alive in order to save the twins. However, this decision was made in conjunction with the family. So it's the hospital and the family making this decision. Now, just like the hospital did in Georgia, where they did the necessary critical care measures in order to keep the organs functioning in order for the babies to survive, the hospital in Brazil did this too. But there is a slight difference that a slew of healthcare professionals also cared for the twins. They would caress the mother's babies, sing and talk to the growing fetuses to ensure they felt the affection their mother could not give them. They also decorated the room, and the article says that the ICU was filled with love and affection and encouragement for the babies and their family to succeed. The articles also said that the mother was visited by the chaplain, music therapist, and other members of the ancillary medical team. I did find one story from January 2025, but I couldn't find multiple articles to verify. It was just from this one obscure source. But as far as we can see, this is not the first time the state has kept the woman alive. And I don't think this is the last time we're going to see a situation like this. As time goes on, the system cannot work if we're not making new people. That's just what it is. And we're going to see a lot of public policy and politics converging on the healthcare system. And as a healthcare worker, these are things we're going to have to stay on top of because we're going to get caught in the crossfire.